Okay, welcome ladies and gentlemen. This is a quick tutorial on the skull. And what I'm going to cover, at least in this first section, is the neocranium. And this is the portion of your skull that's really going to house and protect the brain and the organs of sight, hearing, and balance. So we're going to take a quick tour of the neocranium. And when we refer to the neocranium, we're really referring from the eyebrows up. And you can see the superior view and also a posterior view as well. We're going to start with a anterior view. And the first bone that we can really identify here is our frontal bone. Our frontal bone really makes up, in slang terms, really our forehead. So there's a couple landmarks that we want to pay attention to. We've got the supraorbital border, or also referred to as the supraorbital margin. We have the supraorbital notch as well in foramen that's inside the orbit, and we'll talk a little bit more specifically about the orbit here in a second. We've also got this little process that comes down, and this would be equivalent to that lateral aspect of your eye socket and heading down towards your ear. And this is called the zygomatic process. Now this is a term that we're going to use a couple different times because this is the zygomatic bone, otherwise known as your cheekbone. And there's a little process that's going to connect our forehead to our cheek, and that's called our zygomatic process. And then finally, on our frontal bone, what we may want to notice is the glabella. And the glabella is kind of that area in between your eyebrows, if you will. So this is essentially the glabella is kind of the unibrow of the forehead and the frontal bone here. If we look and change our orientation laterally, we can start to see two specific bones laterally of the neocranium. We've got our parietal bone, which is marked here, and then we have a smaller bone, the temporal bone. Alright, so parietal bone, temporal bone, and what I'm pointing to right here is the squamous portion of the temporal bone. So squamous kind of meaning flattened, kind of like a pancake. So that's the squamous portion of our temporal bone. Looking at some of the other landmarks that we might want to notice, we've got again this projection heading towards the zygomatic bone, or our cheekbone here. So the temporal bone, similar to the frontal bone, will have a zygomatic process. So this would identify the zygomatic process of the temporal bone, while this would identify the zygomatic process of the frontal bone. Some other landmarks that we'll be interested in is the mandibular fossa. So here's our mandible, otherwise known as our jaw, and it's going to connect with our temporal bone in this little section. If you can see it well enough in here, I'll get a little bit closer. This little clear looking section would be referred to as our mandibular fossa. Some other areas that we may be interested in is this is our ear canal, and anatomically speaking, we call this the external auditory meatus. The external auditory meatus. Sometimes you'll actually see it or hear it referred to as the external acoustic meatus. So this is essentially what we're talking about when we talk about our external ear canal. Some other areas of interest on the temporal bone as we go a little bit further posteriorly here would be our mastoid process, this bony process that's coming out here, and this is going to serve the purpose of some muscular attachment of our cervical musculature. We'll talk about that further. And then we also have if you can appreciate this little styloid, this projection-like, finger-like, almost like process that comes out, and we call that our styloid process of the temporal bone. Okay, so that's our major landmarks on the lateral side. Again, our temporal bone, squamous portion, and then this big area here on the lateral side would represent our parietal bone. If we shift our focus posteriorly, now we have our occipital bone. So our occipital bone is basically the posterior portion of our neurocranium. A couple landmarks we may want to notice on our occipital bone is, they're going to be hard to see on this video, but we've got two lines here. They basically are serving as areas of attachment for musculature. So we've got a superior nuchal line, and we've got an inferior nuchal line. And as I mentioned, those become important landmarks for muscular attachments. This little bump on the right in the middle, or in the mid-sagittal, if you will, area of the skull, is what we call the external occipital protuberance. Protuberance meaning just an area that's jutting out, and you can probably actually palpate this on yourself. Some people have a little bit more of a pronounced protuberance, and some others maybe a little flatter. If we go and look at the occipital bone that actually forms the base, or the basilar portion of the skull, so this would be posterior up here, and then we have anterior here, and this again is our posterior view. The big hole in the middle, that's our foramen magnum. So big hole for a big important part of our anatomy, and that's our spinal cord, among some other important vessels and structures that will be going through the foramen magnum. But for the most part, think about this as our canal for our spinal cord to exit. On either side you can see the occipital condyles, and this is what's going to connect basically our head to our cervical spine. If we get a little bit closer, we can start to see some other, let me just reorient here, we can see some other interesting landmarks. We have right by, and I'm not sure you'll be able to see it, but right by these condyles, just posterior to the condyles, this is what we would refer to as the hypoglossal canal. And you can see these, there's a pair of them on either side. If I continue to turn so you get a better look at the base, this little hole right here, let's see if you can see that. There's one on either side. This is going to be the area where our jugular veins are exiting and taking blood back from the brain back down to the heart. So here they are again on either side. So obviously a pretty important vessel. When you hear go for the jugular, this is an important vessel in being able to basically get blood back to the heart from the brain. Okay, so that's our look at the neurocranium, at least the external portions of it. So you can use this as a little study guide for navigating external portions of the skull.